public health is not just our own community, it's not just our own country, but it's actually, public health is global.
The 2019 coronavirus has been rapidly spreading in China and across the globe. As of February 19, there were at least 1,100 confirmed cases in 29 countries and territories outside China. In China alone, more than 76,000 confirmed cases. With the global death toll rising more than 2,200, this is not a joke. While we might feel far away from what's going on, the virus has implications beyond just personal health. We've shut down flights, businesses, but honestly, we just don't know very much. So we wanted to get our facts straight. We sat down with Lauren Uhrman, who is a nurse practitioner in Toledo, Ohio, to talk about some basics, and also just a bit on the measures we can take to have a positive contribution to our community's public health. She reminds all of us to be responsible for our local community, which, now is more than ever, connected with the world. Here's some of our conversation.
Coronaviruses like to specifically attack the lungs. So it's believed, it's not proven yet, but it's believed that they go after a receptor called ACE2, angiotensin converting enzyme 2. When it finds those, the ACE2 receptor, and it has a way to somehow trick that cell into thinking it's good, then that cell will let it in, and it basically does the same thing. So that's why you see the symptoms of the coronavirus. All 7 coronaviruses are always related to respiratory, whether it's mild or to the point of fatality.
病毒的传播力似乎有所增强。专家预判，现在疫情进入一个比较严重、复杂的时期。
The numbers change on a daily basis, and as of right now, I believe it's maybe over 40,000 that have been infected with this virus. Again, I think that number is probably low because there's probably many people that have the virus don't know it. But again, it's basically increasing as we speak, as we're sitting here right now. I think it's difficult science sometimes because viruses can mutate extremely fast and easy, especially this virus because it's a single-stranded RNA virus. So it has a way to replicate and mutate itself. So then it's really difficult to figure out where did it come from. There's a lot of unknowns for this virus. I think one thing is that the rate that it's spreading is pretty quick. And again, if we would know the real numbers, I think we would maybe be a little more shocked at how fast it is spreading.
The CDC has confirmed another coronavirus infection here in the U.S. America's 15th case comes as infections skyrocket across mainland China and spread worldwide. Chinese officials now say that they've confirmed nearly 64,000 cases of the virus and roughly 1,400 deaths.
We wish that we could tell you exactly what the next few weeks and months will mean. Our current strategy is really a containment one, focused on our borders and focused on intense evaluation around each confirmed case.
I think a healthcare professional should definitely, absolutely take more precaution to what is going on right now. So if we use China, for example, where the outbreak is happening, multiple healthcare providers have actually contracted this disease. It's been transmitted to them while they're taking care of patients with this. I think that is a big red flag for us here in America. We're not facing it right now, but we could be. I don't think it would be going overboard for all of us medical professionals at this time, especially, to take responsibility in just doing basic things that can protect us. And we all know what they are, is hand washing, wearing gloves, wearing a mask as needed. Just very basic. We are at the front lines. We're taking care of sick people all the time. And that leaves us extremely vulnerable. We should definitely learn from what China's going through right now and apply it and not do it when it's too late, not when it hits us out of nowhere and then we're scrambling around and everybody's getting sick. So I think it is our responsibility to pay attention, to be aware, to be alert of what is going on all around the world, even if it's not happening right here in the Midwest. Knowledge is power. So if we can kind of educate ourselves about what's going on and then what to do about what's going on, what measures we can take, that is actually protecting ourselves, protecting our immune system and protecting others.